Good evening, everyone, and welcome all of you. I'm Tony Segreto, and once again, so honored to be your moderator for another informative and very timely, I stress that, In the Know Town Hall. Tonight is our chance to candidly engage with some of the brightest medical minds at UHealth on a very relevant topic, especially when you consider the demands on our lives today, both professionally and personally. I'm talking about stress. Stress and its impact on our health. What's intriguing, though, about tonight's In the Know is that we'll be discussing stress from a very unique angle. The science behind good stress. That's right, there is good stress. Now, we usually think of stress as our experience of actual or perceived threats that lead to a multitude of disorders from anxiety and depression to heart disease and gastrointestinal problems. But tonight, we're going to discuss short-term stress, which can actually help us tackle everyday challenges and meet our goals. In fact, this kind of stress can also enhance protective immune response during surgery and vaccination. Now, while extensive research tells us what the impact of bad stress has on our health, we are now only just discovering the science of good stress. Our experts are exploring an important question, and here's that question. Can stress actually help us improve our mind-body functions? Well, tonight's discussion, we're going to look at groundbreaking research from our experts on stress and share information on the best ways to manage and leverage good stress. Now, I know I have mentioned this before with other In the Knows, with the doctors we've had, and kind of joke that it's the Mount Rushmore of doctors. Well, it really applies tonight. I mean, wait till you hear who we have as our outstanding physician scientist tonight. Leading off with Dr. Firdaus Dabar. He's the director of the Laboratory of Stress and Resilience in Health and Healing and professor in the Department of Psychiatry and the Department of Microbiology and Immunology at the Miller School of Medicine. But he's also the director of the Scholarly Concentration in Mind and Body Medicine at Miller School of Medicine. Now, the overall goal of Dr. Dabar's research is to use scientifically derived methods to activate and harness the natural healing mechanisms that exist within a patient, while also working with all other approaches that medicine can provide from the outside. His work has shown that one way of activating natural healing mechanisms is through the short-term or good stress response that we're going to hear about later tonight. And Dr. Barbara Coffey is the professor and chair of the Department of Psychiatry and Behavioral Sciences. She's also the division chief of child adolescent psychiatry and director of UHealth's Tourette Center of Excellence at the Miller School of Medicine. Dr. Coffey is an internationally recognized specialist in tics-Tourette disorder and related disorders like ADHD and OCD. She can help us explore the role of medication in managing stress, and how about the impact of stress on our children. And finally, Dr. Felicia Gould. She's the assistant professor in the Department of Psychiatry and Behavioral Sciences at the Miller School of Medicine. And as a neuropsychologist, she's going to help us navigate the topic of stress and mental health. As you can see, right? The Mount Rushmore. How fortunate and blessed are we to have that expertise tonight before us. Now, before we get started, let's go over how you can participate in tonight's conversation. You're going to all have the opportunity to submit questions during the program. For those of you who have been with us before, you know the drill. For those of you who are new, at the bottom of your screen, you see a Q&A feature. You use that Q&A feature to send us your questions. All of your questions will be anonymous, and we will get to as many of them as we possibly can. Now, we already have some questions that you've submitted, so we're going to not waste any time, and we're going to start right now. And Dr. Dabar, what an honor and a pleasure to have you with us tonight, for taking the time to be with us tonight. We cannot wait for this hour. So the first question goes to you. How do you define stress, and what makes good stress different from bad stress?
Thank you, Tony. Thank you for all that you do for all of us at UHealth and the U, and the warm and wonderful way in which you do it. And a warm welcome to our audience. We define stress as a constellation of events that begins with a stimulus. This is the stressor, or the stress-inducing agent, that precipitates a reaction in the brain. This is your stress perception and evaluation that then activates fight or flight systems in the body. This is your biological stress response, which is critically needed in order for stress to have effects on the brain and body. Now, while discussing and investigating stress, it's very important to consider all the three components of stress: the stressor, stress perception, and the stress response, and to be clear about which component you're discussing or investigating. The duration of the stress response appears to be a key factor that differentiates good from bad stress. Short-term stress is good stress. This is when our stress response lasts for a few minutes to a few hours in duration. This is the way Mother Nature intended our stress response to work for us. And this response is activated under different conditions, and it is designed by Mother Nature to enable us to deal with threatening conditions or challenging conditions, rewarding but challenging conditions. And my lab works on inducing and harnessing good stress to enhance health, healing, and hopefully also nearly performance. Now, long-term or chronic stress, on the other hand, is when our stress response is activated for prolonged periods of time. So this is weeks to months to years in duration. And this is not the way Mother Nature really intended the stress response to work for us. And our department, the Department of Psychiatry, works on eliminating, amongst other things, works on eliminating and ameliorating bad stress and its deleterious effects. And in addition to working on good stress, my lab also works on this angle. And if there's time later, we can talk about the actual biological differences between these two types of good versus bad stress.
Great, doctor. Yes, I am sure we're going to get into what determines good stress and what determines bad stress. Dr. Gould, we welcome you to our panel tonight. And this question is for you. In fact, it was submitted earlier in the day. Are there specific exercises and certain foods to manage bad stress?
So yes, in fact, there are numerous exercises that you can engage in. Any type of physical exercise is actually good and helps you deal with stress. And I always tell my patients, the best type of exercise is the one you're actually going to perform. And whatever you like and you can do consistently, that's the best type of exercise. Although I am a bit biased, I do love yoga in terms of coping with stress. And that's because yoga involves deep diaphragmatic breathing, which I'm sure we'll talk about more later, is an excellent way to cope with stress. And yoga classes actually end typically with a relaxation portion, which they call shavasana, where you're literally laying there and breathing and relaxing. And that kind of downtime just doesn't happen in any other form of exercise. So I do tend to recommend yoga, but again, any form of exercise. With respect to diet, typically it's just about a healthy diet. And I would say that having a healthy, balanced diet, green leafy vegetables, all that sort of thing tends to be a lot better for people in terms of coping with stress than, excessive dessert eating and the typical things we know are not good for us. And I would end with another thing I advise my patients typically is to avoid excessive amounts of caffeine, because that tends to make us more nervous and jittery, and it tends to make anxiety worse, which can be a negative response to stress as well. So I would say cutting out caffeine and eating a healthy diet are typically the best recommendations.
How did I know you'd bring dessert into this? I just knew it. Dr. Coffey, we welcome you back for our next question. For those of you who have been with us before, Dr. Coffey joined us early on in the Know series during the pandemic. So it's great to see you again, Doctor. Thank you for being with us tonight. Can stress be chronic?
Yes, well, thank you, Tony. It's good to see you again. And thank you for inviting me to participate in this panel. And thank you to our audience for attending the webinar. Yes, stress can certainly become chronic. And going back to what Dr. DeBar was saying, the sort of inflection point between good stress and bad stress is the point at which, if those factors that produce the stress are not eliminated or ameliorated, bad stress can become chronic. We have ways of defining chronicity. For example, if managing stress is becoming particularly difficult for someone and it's acute, then we can diagnose what's called an acute stress disorder, which means the stress has been present, leading to excessive fearful behaviors for more than 3 days, but less than a month. That's how we kind of define the duration. Chronic stress, by definition, then would be stress that continues with the same kind of physiological and emotional and psychological reactions we would see with acute stress reactions, but it becomes protracted. In other words, that initial stressor has gone away, but the bad stress reactions, which can kind of blend in with anxiety, persist. And that can have physiological ramifications, meaning physical symptoms, headaches, shortness of breath, clammy hands, chest tightness. It can have psychological manifestations, worry, excessive worry. And it can have sort of emotional reactions, meaning feeling irritable, feeling sad, feeling worried. So it's a big array of symptoms once stress can become chronic. And that's what brings patients to our office oftentimes, is when it doesn't go away after that immediate trigger has been gone.
Thank you, Dr. Hovey. Dr. DeBar, we're going to come back to you. This was sent in earlier in the week. Can stress cause cancer?
Thank you, Tony. This is a very important question that we are often asked. And the research shows that stress does not cause cancer per se, but chronic stress, that is bad stress, can induce conditions that could favor the development of some types of cancer. For example, chronic stress can suppress protective immunity and enhance harmful inflammation. And such conditions can favor the formation of some types of cancer. There are other things that chronic stress does, such as accelerating certain biological aging mechanisms that can, again, create conditions that are favorable for the formation and progression of cancers. And our group, we do most of our work in humans, but we do some work preclinically in mice. And our group and others have shown that even in animal models, chronic stress can worsen conditions that can favor the development of cancer. But it's very, very, very important for everyone to understand that getting cancer is nobody's fault. Can I say this? Because when I give talks and meet with clinical groups, patient groups, you often hear that some patients blame themselves for not having managed stress better, for not having done this. They blame themselves for not being able to get well. And it's very important that that self-blame is really not deserved. Why we get stressed, when and how that stress affects us, they're very complex sort of relationship that are dependent on time, conditions, and we'd have to just be superhuman to just handle everything just right and say, oh, it was actually within my control and I didn't do it right. Okay, it's not natural to be that way. And so it's really, really important not to blame oneself because it's not justified and it's not going to be helpful. It's also important to keep in mind how stressful cancer diagnosis and treatment can be, but I'll stop here and hopefully we'll get a chance to go into that later in terms of dealing with that chronic bad stress generated by being diagnosed with a disease such as cancer or many other types of diseases, and the tremendous hit that the treatment itself can bring upon the patient and survivor.
Doctor, you bring out such a great point, and I'm just going to throw this in. I mean, it seems though, since the pandemic and a little before the pandemic, stress has become the paramount worry, for lack of a better way of putting it, concern for most people because of the demands on our lives, both personally and professionally.
Yes, unfortunately, it has, and yet it's kind of unfortunate because for most of us who are fortunate enough not to be dealing with life-threatening challenges, it shouldn't be that hard to put everything into perspective. Okay, and we can talk a little bit more about that later in terms of how, for those of us who are fortunate to not be dealing with life-threatening challenges, and don't get me wrong, I right now have a tremendous amount of chronic stress that I deal with, but I can put it into perspective because it's not, fortunately, thankfully, not life-threatening for myself or my loved ones. So to have that is very important to recognize, and it's very important to recognize that there are things that one could genuinely do for oneself, as well as that we could do to help one another that are not that hard, that unfortunately we don't always do. And I would love to set up in some way, a chain reaction in our society where that pro-social, compassion-generating, helpfulness, and social support-giving behaviors and attitudes come about, and that could go a long way to reducing the kind of stress that many of us experience that is not that life-threatening level.
Yeah, I think we'd all love that, Doctor, and the people on the panel, obviously, and those who are watching us tonight. Thank you, Doctor. Dr. Gould, we're going to come back to you. This question was submitted as well. How can mindfulness affect stress?
Sure. So mindfulness, to basically define it, it's the basic human ability to be fully present and aware. And you can use this to shift your awareness away from things that are really distressing you and bothering you, to something that is more tasteful or pleasing in the moment. You can cultivate sort of a different awareness, and typically mindfulness skills will involve using different senses. We'll use the sense of touch, hearing, taste, to help cultivate an alternative sense of reality, or an awareness, if you will. But mindfulness, therefore, it can be available to someone in the moment when they're constantly worried about something else. We can sort of shift our focus and be aware of something more pleasant in the environment, like a pretty flower, or, you can focus in on, how the pretty flower looks and how the leaves or the stem feels in your hand. And you can smell the scent of the flower, and you can sort of have a mindfulness experience just holding a flower, as simple as that. Some of our UN mindfulness experts will do mindfulness based techniques whereby you just simply sit in your chair and you focus in on the connection of your seat to your chair, and that sort of connection of your body to where you're sitting. And just by focusing on that, it sort of removes you from where you just were mentally. So that's just sort of a simplistic example of how mindfulness can help someone when they're distressed or having bad stress.
Yeah, I would think vivid visualization would also play a role.
Yes, certainly you'll use the sense of vision as well. The more you use all 5 senses to deepen your awareness, the better mindfulness works. So it is a practice, and there's something called mindfulness-based stress reduction. That's an evidence-based technique to reduce bad stress.
Thank you, Dr. Gould. Dr. DeBar, we're going to come back to you. So we touched on this earlier. What is the biological manifestation of good stress, and how does this differ from bad stress?
Thank you for the question. So again, we find the duration of the biological stress response is a very important factor that differentiates good from bad stress. When the duration of the biological response is short-term, meaning it lasts for minutes to hours, that's going to promote the protective aspects of good stress. But if the biological response or the stress-related biological changes last for weeks to months to years, then that is what sort of precipitates the effects of bad stress. So what are some of the important biological changes that take place during good stress? They include increased concentrations of the principal stress hormones, epinephrine or adrenaline, norepinephrine, also called noradrenaline, and cortisol. And these hormones increase in our bloodstream, in the circulation during short-term stress. Now think about this. Every cell in the body has receptors for these hormones. So that means that every cell in the body is capable of receiving the signals that these hormones are set out to convey when the brain decides to tell the glands in the body to release them. And these hormones basically convey the signal of an alert, an alarm reaction, and they tell the body that something threatening or challenging, it need not always be a noxious stimulus. These hormones are elevated under conditions that are either threatening or challenging, is about to happen or is already happening. So that's the signal that is conveyed. Now, we discovered that another important biological marker of good stress involves rapid and significant changes in immune cell distribution in the body. So we found that if the immune cells are like the body's soldiers, during short-term stress, these soldiers quickly move from their barracks, which is organs like the spleen, through the body's boulevards. I'm taking a little bit of poetic license here, but that's the bloodstream, and onto potential battlefields in the body. So another thing that stress biology does is sends immune cells to places where they may need to fight a battle. And the stress biology also enhances the ability of these immune cells to fight battles if they are indeed, if they do indeed encounter an infectious agent or a wound to a place where they go to. For example, the skin and the underlying tissue. If nothing happens in terms of an infectious agent entering the body or there being a wound in conjunction with stress, then the beauty of the system is that everything goes back to normal, goes back to baseline resting conditions within about 3 to 4 hours after the end of the stress response. So it's a rapid response, rapidly mounted and rapidly shut down. So the key for good stress is just that it's you mount a rapid and robust biological response as soon as you need it, and then you shut it down as soon as possible. And in contrast, chronic stress has biological manifestations that include chronic long-term changes or increases in stress-related hormones, but they needn't always be increases, it's just a change. There are low-level increases and area under the curve exposure to the actions of these hormones, such as cortisol. Then there are increased low levels of inflammation and inflammatory factors that one sees as a biological change during chronic stress. Increased biological aging, like I mentioned earlier. And then also, very importantly, there is disruption of sleep and circadian cycles. And this is actually quite a salient factor that when that happens, and Dr. Coffey touched upon this too, I think earlier, that when that happens is one of the first signs that at least we've seen in our studies, and we need to do more work to confirm this. But when you see a disruption in sleep and circadian cycles during chronic stress, it's one of the first salient signs that now the bad effects of chronic stress are likely to begin. So until that point, you have your resilience, which is another beautiful thing that if we have time later, we should talk about. And your resilience maintains your status quo. Nothing good happens, but nothing bad happens. But when the circadian rhythms begin to show a breakdown is when you begin to see the negative effects of chronic stress.
Great. Thank you, Dr. DeBar. Dr. Coffey, would you like to weigh in on this since Dr. DeBar talked about it?
Yes, that's a great segue into one of the major manifestations of bad stress in both children and adults, which is disrupted sleep. As Dr. DeBar mentioned, the circadian rhythm cycle gets really set off. And so sometimes even before, for example, with a child, before a child is showing daytime manifestations of anxiety or worries, the parent will report, suddenly Johnny hasn't been able to fall asleep at night. And for a young child who's been able to sleep in their bed all night successfully, the child is coming back into the parent's bedroom at night. So often sleep disruption is a very first sign, particularly in children, of stress or ongoing stress. Certainly, and that's a major manifestation of anxiety and depression, which can also be associated with anxiety in adolescents and adults, in addition to the things I mentioned earlier, chest tightness, physical symptoms, headaches, dizziness, cold and clammy hands. You can see disrupted sleep, and it can take all forms from sleep initiation difficulty, that is falling asleep, to sleep maintenance, that is being able to stay asleep all night, to early morning awakening. So that's clinically one of the first things we look into in terms of finding out about, is this stress, is this anxiety, is this depression, by looking at the clinical signs around sleep. So very important.
Great. Thank you, Dr. Coffey. Dr. Gould, this was just sent in. What role does our inner dialogue, self-talk, do, and how does that play in managing stress and the stressors? It used to be what we are what we eat. Now we are what we think, right?
I think it's both. Well, as a cognitive behavioral therapist, I think our inner dialogue is incredibly important. How we talk to ourselves, how we treat ourselves, our behaviors all matter. But our inner dialogue sometimes can be excessively negative or distorted. So one of the techniques that we use in cognitive behavioral therapy is to work on changing those thoughts to make them more neutral and reality or evidence-based. And sort of just by getting rid of the excessive negativity and neutralizing thoughts, people tend to have a stress reduction associated with that. So the inner dialogue is incredibly important. We want to make sure that we're speaking to ourselves in ways that are not excessively negative. But my work would tell me that it doesn't also have to be always positive either. Neutral self-talk is just as good.
Then let me ask you this. How do you know when the good stress becomes bad stress?
So we've been talking a lot about sleep, and that's, one of the main indicators, right? We're going to see a change in your sleep. We're going to see a change in your energy levels, your mood, maybe increased irritability, decreased enjoyment of things that you previously enjoyed. That's when we start getting concerned and we start thinking, okay, we're really succumbing to the negative impact of bad stress.
Thank you, Dr. Dr. DeBar, we're going to come back to you. And this question was submitted earlier. Please discuss the effects of ongoing medical stress cancer patients and survivors' experience related to treatment and surgery. And this is something you touched on earlier.
Yes, this is another, very relevant question about a tough real life situation that involving chronic stress. And for most people, cancer diagnosis and treatment, leads to chronic stress, to tremendous amounts of chronic stress. There's not only the psychological stress of dealing with a very disruptive and potentially terminal disease, but there are biological changes induced by some cancer treatments themselves that can activate stress biology by certain biological factors having direct actions on the brain. So there is a tremendous hit in terms of chronic stress generating factors from multiple sides. And this is a condition where I believe we as humans should do everything possible to support and help the cancer survivor and their loved ones without intruding into their space. Okay, whatever. Sometimes you're in a position where you can do very little. Sometimes you can't do anything, and that's fine. But many of us are in a position where you can do little, and sometimes you can do a lot. I mean, the frontline folks who actually treat these patients, our colleagues here, are the folks who can do a lot. But there's many things that one could do. Okay. Social support, which is part of what one could provide if it's genuine, heartfelt, is one of the most important buffers against the deleterious effects of chronic stress. So it's okay if you don't have an MD and if you haven't spent a lifetime studying the latest sort of chemotherapy and the different kinds of therapies available. As a person, whatever one's engagement can be, there are little things that one could do that could make a tremendous difference. Related to this, my lab is currently conducting a study on the effects of good versus bad stress in the context of surgery for gastrointestinal cancer. And we are looking at both surgical recovery as well as oncological outcomes. Okay, this is with my colleague Nipun Merchant and his team. And we hope to expand this study to also look at breast surgery, both in the context of cancer and cosmetic breast surgery. And our goals are to try to understand, one part of the study looks at the effects of good stress around the time of actually undergoing surgery, as well as around the different treatment procedures that the patient comes in for. But another part of the study looks at, as comprehensively as possible, chronic stress and psychosocial factors that are related to chronic stress, and psychosocial factors that are in and of themselves buffers against chronic stress or exacerbators of chronic stress. And we want to try to understand what are the the most important elements of cancer-related treatment and surgery that are most damaging psychologically, biologically, and physiologically, and what can we do to identify ways to intervene, to lessen, if not eliminate, the impact of the bad factors and to maximize the impact of the good factors. And I do want to say here that we really welcome input from patients, survivors, their families, and their loved ones. So please email me, either fdebar@miami.edu, or it's easier, just my last name at gmail.com. If you have thoughts, ideas for what we could do, that would be most helpful for you, because we really believe this, and it's not just us, it's, I would say, largely the ethos that's developing here at UHealth and at the U, where we want to do things as a partnership with, with the larger community, and not just sit in our ivory tower and figure out what we think is important to study and then look at that, but actually really engage and learn and ask our partners, what is it that you feel would be really important to folks who are in the predicament that you find yourself in, and yourself, and how might we use the power of our research and all the armamentarium that we have to do something that maximizes the chances that the work would be helpful to you.
If I may add something, can you just talk about how important support is for your stressor if you're diagnosed with cancer or going through cancer treatment? So family support or support from people who have been through it before, that can help guide and navigate the stressors that you experience?
Tony, this is a great point, Tony. Thank you. Support, we find over and over, in different studies, not just our studies, but colleagues independently who have done studies, we find that support, social support of any kind, even better if it's really genuine support, is a huge buffer against multiple deleterious effects of stress. So there's no doubt that if there is support in different ways, it could be actually just helping someone navigate all the logistics of the medical system, or it could be showing support in terms of sort of love and actions that actually say, hey, you know what, to whatever extent I can be here, I am here for you. We are here for you. We are here not just for you, because oftentimes the big concern of the patient or the survivor is, who's going to look after my family? Who's going to look after my kids, right? That's another stressor. So any kind of support that can be conveyed to whatever extent is possible for anybody who's in a position to convey it is actually a hugely beneficial factor, a huge buffer against the deleterious effects of chronic stress. And we actually have some studies that show actual biological differences. This study that I'm referring to of ours is not in cancer patients, but it could apply. And other folks have similar studies where if there's a factor, and I won't go into details and won't take too much time, but if there's a factor that's likely to be detrimental, biological factor that's being increased in the blood, for example, under certain conditions, for people who report having social support, meaning one or two people even in their lives that they could count on, that factor is actually significantly reduced or lower than for people who report not having much social support in their lives. We see this kind of effect of social support over and over, including in academic exam performance. This is a preliminary result still. We have to still do the study thoroughly and complete it and gather more data. But you see the effects of social support, positive effects, multiple ways across the board.
Dr. Dabar, thank you so much. Dr. Coffey, can stress cause or trigger AFib?
Well, full disclosure, I'm not a cardiologist, so I will only talk about my experience as a psychiatrist in dealing with patients with medical illness. No, it doesn't cause atrial fibrillation. Atrial fibrillation is a complex disorder with genetic vulnerability, with abnormal growth in the atrial cells in the heart. And the biggest risk factor, in my understanding, it's probably still true, is aging. The older you get, the more at risk you are for atrial fibrillation and other cardiovascular disorders. The risk factors that we know are true, not just of AFib, but of other cardiovascular disorders, are the things we all think about that could be related to stress. For example, obesity, overweight, high blood pressure, diabetes, things that we do know have a stress component to it. So indirectly, if stress has been leading to overeating, let's say, and this adds up, so to speak, to obesity over time, or high blood pressure that isn't well controlled, those elements of stress could contribute to atrial fibrillation, but cause, no, not directly.
Great. Thank you, Dr. Coffey. Dr. Gould, could you please speak a bit more about stress and sleep problems? I assume that as I aged, this, by the way, this was just sent in, as I aged, poor sleep was inevitable. How would I know if my frequent awakening is due to stress?
So sleep is a really important thing to talk about. We've already talked about it a lot because it's one of the first things that we see break down. And I'll often say that most of my patients that come to see me and are diagnosed with a mental health condition either sleep excessively, too much, or not enough. And probably more are not getting enough. I don't believe that everyone as they age will inevitably have lots of sleep difficulties. There are plenty of people as they age that are able to get a good night's sleep. But of course, there are age-related changes. Women often report experiences due to menopause and perimenopause that impacts their sleep. But certainly, there's also a chicken egg phenomenon going on here, because poor sleep can cause stress, and stress can cause poor sleep. So it's really important to use good sleep hygiene. Be attentive again of that caffeine, because caffeine can really keep you up at night. I've had patients come in before saying, I'm sleeping terribly, and I find out they're drinking a pot of coffee at 4 o'clock. So stuff like that we really have to be aware of. But how do we know poor sleep is due to stress? We have to sort of look at, what kind of bad stressors are you dealing with? What kind of chronic stressors are going on in your life right now? What are you worried about? And I think it's worth exploring that and then seeing how that impacts, your sleep. If you had a particularly tough day, at work, and you've had a lot of chronic work stress, you see worse problems sleeping that night, you might see a connection there. But you sort of have to look at all the factors that are going on and make sure you're doing good sleep hygiene, watching that caffeine, and going to bed around the same time every night, and doing all the things you're supposed to do to facilitate a good night's sleep. And then see, is it worry? Is it worry that's keeping me up? Is it the bad day at the office and I just can't seem to let it go? And, to get that social support, talk it over with a friend, talk it out with a family member that is supportive to you. And if you're really struggling, I encourage everyone to seek help. I think the most important thing that I would like the audience to take away from tonight is that just simply because everyone experiences stress, that's not a reason not to seek help when you feel overwhelmed, or when these little things like reduce caffeine and, cut out, that extra dessert you're having before you go to bed. When these techniques are not enough and they're failing you, I really encourage you to seek out extra help, because psychologists, psychiatrists, there's a whole team of people in mental health that are able to help. Counselors, social workers, all are trained to address some of these sleep-related issues and, the effects of bad stress and so forth.
So, Dr. Gould, here's the million-dollar question. How can we reduce or control stress?
So I think there's a great many things that we can do that are more general. Like I said, we can say to you, get a good night's sleep, get physical exercise. There's increasing evidence that spending time outdoors is helpful for alleviating stress. Socializing, getting social support, talking about your stress, using good time management. All of these things can help, but inevitably we are all going to experience, stress in life. So we can't control, stress coming at us, but we can sort of make sure we're doing our best to cope with it. And we can confront, like we talked about earlier, our inner dialogue about stress, how we're talking to ourselves, how we think that we're doing, and how we perceive our stress. Do we think our stress is going, in the case of many people with anxiety disorders, panic disorder, for one, people believe that the stress is going to potentially kill them, that they're going to have a panic attack and potentially die, which is incredibly scary. So it really has to do with, we can't control the onset of the stress per se, but we can improve the way that we cope with the stressor.
All right, got Dr. Gould, thank you. Dr. DeBar, we have a couple questions for you here. This one was just sent in. Can alcohol consumption increase stress?
Yes, well, certainly if it goes into an excessive consumption pattern, with or without other sort of risky behaviors that go with that, then it can. Again, both through psychological mechanisms, including sort of inhibiting judgment calls and perhaps promoting other harmful behaviors, as well as physiological mechanisms, because the changes induced by alcohol in the body can also feed on the brain and actually activate the same hormones that are activated during a psychological stress response, or a similar hormonal profile. And then related disruptions that can be caused, by alcohol could also contribute to the negative aspects of the mix. I don't want to say this definitively, but one could argue that if alcohol is taken in the context of a glass of wine under, wholesome, salubrious, relaxing conditions, that is not going to become an excessive, pattern that's damaging to the person, and is just really going to help the person feel nice and relax, then that's not a bad thing.
Thank you, Dr. DeBar. We'll be back to you in a second. Dr. Coffey, we need to ask this because people have been asking us tonight. The difference between stress and anxiety.
It's a very good question. I think that's one of the things we try to separate out when we see a patient in the office initially. Is this a person who's under stress? There's been a clear trigger or precipitant of that stress, or have they been dealing with these symptoms for a long time and there's no identifiable trigger? So the main difference is primarily in duration of the experience. As Dr. DeBar was mentioning, physiologically, there's a very acute reaction. It's the fight or flight in response to stress. Most people are resilient and will be able to work through that psychologically and physiologically. However, some people are vulnerable. Up to about 30% of adults in this country will have had an anxiety disorder in their lifetime. We don't always know what those vulnerabilities are, but when those worries and stress reactions are persistent and pervasive and of longer duration, then we're crossing into territory of an anxiety disorder. We have a diagnostic classification system that we can identify the different subtypes of anxiety disorder, whether it's generalized anxiety disorder, which is a worrier type, whether it's panic disorder, as Dr. Gould was mentioning, where you get really a sudden surge of physiological symptoms with a terrible feeling that you're going to die, whether it's social anxiety disorder, where individuals are very reluctant to speak up in front of others, to engage with others, whether it's post-traumatic stress disorder, which comes after a major stress or life-threatening either has occurred or has been witnessed to, and that fight or flight reaction doesn't go away after time. So there's a whole host of those things. And luckily, psychiatrists and psychologists are trained to figure out, is this just a stress reaction that this individual who's otherwise resilient is going to get through, or is this a person who has other challenges that may render them more vulnerable to an anxiety disorder?
Fascinating, Dr. Coffey. Thank you. Dr. DeBar, let's go back to good stress. What has your research shown about the effects of good stress during surgery, vaccination, and cancer treatment?
Thank you, Tony. So our research has shown that a short-term stress response can enhance immune function during wound healing, including surgical healing, during vaccination, and perhaps during some types of cancer treatment. Okay, the short-term stress response enhances immune function by, one, delivering more immune cells to a site of wounding, surgery, vaccination, or cancer, like I explained earlier. Two, it increases the functional ability of the cells. So not only does it send more troops to where they may be needed, it meaning your short-term stress response, sends more troops to where they may be needed, but it enhances the ability of the cells to do whatever their job is. And it also induces the production of cytokines that are important immune molecules that may, under some conditions, play a role in enhancing protective immune responses. So thankfully, we were able to take our research from the lab to the clinic in one single step. So initially, we figured everything out in basic studies, and then we wanted to test it clinically, which is very important to do whenever possible. And so we did that. And we showed in humans that patients undergoing surgery who naturally mount an adaptive or good stress response during surgery, induced by the process of undergoing surgery, show significantly better recovery and report less pain than patients who do not mount an adaptive or good short-term stress response during surgery. And the difference, the advantage that the patients who could mount a good stress response during surgery naturally, the advantage lasted for the entire year during which we followed the healing progress and the pain scores in these patients. So it's a pretty significant effect when it works. And as I mentioned earlier, with my colleague Nipun Merchant and his team, and hopefully soon Devender Singh and their team and his team, we'll be doing follow-up studies to look at both the effects of good versus bad stress here, at UHealth. It's also been shown that if you induce a short-term stress response, okay, so you get somebody to exercise for 20 minutes before they get their vaccine, or psychologically induce stress by making them do mental arithmetic and make a speech in front of an audience. If you induce stress and then vaccinate someone, the vaccine response is actually higher, okay? And we have been trying very hard to secure funding to actually take these studies to the next stage to figure out how do you naturally induce these stressors, good stressors, and use them to make vaccines work better, and also to enhance surgical healing. The last bit, where the implications of the effects of good stress for cancer treatment is still in the preclinical stage, so it's in the lab work stage, but been trying for a while now to secure funding to actually do one more set of experiments in the lab stage before we can see what we can do about this in the clinic. But what we know from mouse studies suggests that if there is a tumor on board, we have a very naturalistic model for squamous cell carcinoma that we study, and we've shown that if there is a naturalistic tumor on board and you simply pulse the system with a stress, I'm just going to say this very loosely, it's kind of like having somebody exercise for a short while once a week. You begin to enhance, at least in this model, it may not apply to all types of cancers in all models, but at least in the model that we study, or cancers that are immunoresponsive, you enhance the natural immune attack against the tumors, and you begin to naturally regress the tumors using the mouse's own immune system. So of course, we need to do a lot more work, but it's exciting and promising that if it all works out, in some conditions, we may be able to harness the short-term stress response and its biology to drive anti-tumor responses. Again, don't want to overpromise, so it'll be some types, and a lot has to be worked out before we can do that.
Thank you, Dr. DeBar. I'll tell you what, that arithmetic would put me under real quick. Dr. Gould, we have one just submitted and one to add to it real quick. So the one that was just submitted to us from the audience is, how does adverse childhood experiences affect our ability to manage stress? And then the other part that we have for you is, when should someone finally seek help to deal with stress and anxiety?
So that's an excellent question. Early life trauma or adverse childhood events, child abuse, those are really terms to describe child abuse. That experience is one of the most robust predictors of mental illness that exists. So these individuals are typically at risk, and they experience changes in their stress response systems biologically from childhood on, that make them vulnerable to developing mental health conditions later on. So it absolutely has to do with how you deal with stress, and it does play an important part. And remind me, sorry, what was the second part of the question again? That was the early life stress, and then the second part was, when
is it time that you know to get help? How do I know that? I'm trying to manage it myself. I'm not getting anywhere. I see a little improvement, but at what point do I say, okay, I have to admit I have an issue and I've got to go find somebody?
So, so I would say, again, we're talking a lot about how bad stress are these chronic stressors. When you've been dealing with chronic stressors that are resulting in these changes in your sleep patterns, in your mood, you're increasingly irritable, you're having maybe some trouble keeping up at work, you're not doing as well in your social life and in your relationships. When you're seeing these changes and these changes are going on for several months at a time, I would say then it's the time to seek help. After a certain amount of months, you may qualify for something called an adjustment disorder. So I would really say we should see things sort of improving and balancing themselves out within a month or so. But if it continues on, it's really time to seek help for sure. And if you're not sure, don't wait, because sometimes our gauge of when did this really start, it's hard to know that. So err on the side of getting professional help for sure.
Great. Thank you, Dr. Gould. Now listen, I'm going to direct this to Dr. Coffey, but Dr. DeBar and Dr. Gould, if you'd like to weigh in, I think it would be important. And that is a good stress response based on mindset, or is it innate? And this was just sent in to us. Dr. Coffey, would you like to start?
Sure. And this is a question I think all of us could bring our perspective to. As Dr. DeBar mentioned, we have built-in physiological responses to stress that we can use and harness for supporting our resilience. I don't think we have predictors if we see somebody coming in the office to know who's going to have those positive responses physiologically and what role that might play in their mindset. We do know that mindset can make a great deal of difference in how resilient you are. And I think resilience as a character, a style, and as a trait plays a great deal of a role in psychological response to stress. So I think both of those can play a role.
Right. Dr. DeBar, would you like to weigh in on this?
Or thanks. I mean, Dr. Coffey, was right on the mark, and I would add to that it's probably both. So innate would be your basic biology, including sort of the genetic makeup that at some point affects the brain circuitry. And that means that innate, to a certain extent, can actually affect mindset, or at least the basal mindset that you have. But the beauty of biology and also the brain is that there is plasticity, that there is room for learning, so that whatever innateness the biology sets is not just set in stone. There is ability for it to change. It can change for the positive. Unfortunately, it can also change for the negative. And that means that one can also learn, like many people say, that even happiness, there's a certain intrinsic amount of happiness that one could say different personalities innately have, but one can actually work one's mindset to genuinely, not fake it, but to genuinely sort of affect the level of happiness that you have. So in a similar way, I think the ability to mount these good stress responses is a combination of both. But we do see, and this is where, like I said, most of our work is in humans, but we do some work in mice. And this is where the beauty of being very carefully able to do, sort of work in mice in a real life setting as much as possible is helpful. Because in this case, one, standardizes the diet and the mindset and everything, one might say. But yet when we work with genetically outbred strains, right off the bat at baseline, when they're little, you can actually see differences. And one might say, well, those are the innate differences in stress reactivity, in anxiety-like behavior, in being less anxious, in being more anxious. And then there are the biological correlates that go with that. So the innate aspect is not trivial, but it can often be modified, sometimes tremendously.
Thank you, Dr. DeBar. Dr. Gould, we have just a little bit of time. I saw you nodding your head. So why don't you say the last word concerning this issue?
The last word that I would say is simply that it's never too late. I treat patients of all ages, and regardless of whether or not you've experienced adverse childhood experiences, child abuse, regardless of the biological load that you were born with, it's never too late to get help and learn to cope with bad stress better. And again, encouraging everyone out there that is interested in seeking out help to please do so.
Dr. Gould, thank you. Dr. DeBar, and Dr. Coffey, I don't know where this hour went. I mean, it is truly remarkable. And Dr. DeBar, we have another minute before we're going to say goodnight to everybody. I think it's important if you would like to have one last word before we go tonight.
Well, thank you. I would just echo and support what Dr. Gould said, that it's never too late. So go ahead and either seek help for what you can do for yourself. You don't always have to go to Dr. Gould or Dr. Coffey, although it is very, very important that you do if you need to. And the other aspect that I can't stress enough is this issue of really trying to think about how one could express, nurture, and grow the humanity that intrinsically makes us humans, and that we all have. Because I think that enabling those pro-social factors, that humanity to just come out individually and as a society in small groups, say, for example, at work, as well as in larger groups, for example, in neighborhoods and cities and the units in which we live, enabling those pro-social factors to come out would be a long, long way and a very effective way to bring down a tremendous amount of the chronic stress that we all are exposed to. A lot of it is what I feel unnecessary. And of course, I have many more thoughts on this, but I'll keep it brief and stop here.
Dr. DeBar, Dr. Gould, Dr. Coffey, wow. This has been an eye-opening discussion, and you're extraordinary. You're also passionate, and your insights have been just absolutely remarkable. And the stress and the impact on our lives was really evident tonight, and how we can handle it. And again, I just don't think, ladies and gentlemen, is still with us, and no one's dropped off. This is remarkable. Don't take for granted how fortunate and blessed we are to have these amazing doctors in our own backyard. I mean, they're available and they're here to give us help. And if there's another takeaway from tonight, and all of us need to just support each other and take time to understand there's a lot of other things going on in people's lives than we know. Well, it's time for us to say goodnight. It's been an incredible town hall, and we thank you all for participating in tonight's In the Know. Please remember that a full recording of this program will be posted online. Look for the link in coming days. And then in a moment, you're going to see a survey about tonight's town hall on your screen. Please take a minute, and trust me, I took it. It doesn't take a minute, because if you fill that out, what it does is that feedback gives us an opportunity to understand your interests and helps us improve our program. As always, we wish you and your family good health. Free yourself of the bad stress. Give yourself the good stress. We wish you nothing but a blessed evening. And remember, it's all about the you. Good night, everyone.